Hey everybody, you are back listening to Senior Radio Buffalo, and I'm Linda Pellegrino. I'm so happy to be here every single weekend. Here's something fun to know. Snails take naps. Some take naps that last as long as 3 years. That's my kind of bug. Actually, a snail isn't a bug, but you get the message. 3 years. So if you run up against a snail, he might be asleep. So if you want to, transplant him, you won't even know what happened. Talk about Rip Van Winkle. That's kind of a funny thing. Well, let me tell you, folks. If you're suffering from pain, you're probably not sleeping well, especially if it's pain in the knee, okay? Every time you turn in the bed, you feel it, and you may be at your wit's end thinking, I've tried everything, I've been to the doctor, I've had a surgery, maybe not, maybe, you've been told everything. A lot of people who are in your position have visited Dr. Stephen Novelli, okay? Now, he's a chiropractic physician at the Novelli Wellness Center, and let me tell you, on Thursday nights, this place is getting crowded, okay, because he is offering some information and a seminar about what they can do to help alleviate your knee pain. And I'm telling you, we really have some incredible stories. So good morning, Dr. Novelli. You're back. It's nice to have you here to talk about this.
Good morning, Linda. Always a pleasure to be here. Good morning to the listeners. Thanks for listening. Thanks for tuning in, guys.
Well, you're doing a wonderful work, and you brought with you Rhonda Stoll, who has been a patient of yours. Rhonda, good morning. Nice to have you here.
Good morning, thank you.
And you've just finished up a 7-week treatment. Is that correct?
That is correct, yesterday.
Tell me what the problem was or is with your knee.
So over the last decade, I've had a lot of knee pain, unable to walk upstairs, downstairs, just walk in general. My knees would give out.
Really?
Sometimes, yeah. So I was just at my wit's end and started looking through social media, and their advertisement came up, and I said, free seminar, why not? What else do you got to lose? And so I did it, and I went, and then I signed up the next week.
Wow, and the funny thing is, folks, when you come here to BEN, you gotta go up 2 flights of steps. And Rhonda, you did so without any problem at all. You don't even go to look for the elevator.
No.
That's great. So you're getting that much relief after only 7 weeks.
Yes.
In fact, Dr. Novelli offers a short and free treatment, so you can try it the first night, and you were feeling better even after that.
Yeah. The first night I tried the knee decompression, the matrix, the laser. They have the laser for the healing of the meniscus and the cartilage, and
Wow.
tried it all.
Do you recall how you first injured your knee, or what they said it was that was wrong with it?
I played sports as a kid,
Ah.
and then just age, and then inability to, it just decreases as your mobility decreases. So just.
You said though you were facing a wheelchair. You weren't just going to handle the pain
A year
anymore.
ago, I was like, I'm going to be in a wheelchair in less than a year, because it's hard to get out of a chair. It was just to go travel with my friends. I was like, oh my God, I'm going to have to get a wheelchair for them to push me around.
Wow. And here you are.
Yep.
So improved today.
So improved. Walked up 2 flights of stairs.
Well,
whatever that was.
Listen,
Amen.
we
That's
have
amazing.
so many people who are listening to this show today saying, I wonder if Dr. Novelli can help me. So Dr. Novelli, let's talk about what it is you can do to help people.
Sure. Well, it's such a blessing to hear your story, Rhonda. Thank you for sharing that with all the listeners, because there's a lot of folks out there who are trying to avoid surgery.
Yeah.
They've had the injections, they've had the medications, they've had the physical therapy, yet they're still struggling with walking, even simple things. And quality of life comes down to your satisfaction as a human being, right? Comes down to, can I do the basic daily activities? And for us to be able to help people restore that, keeping them out of surgery, keeping them out of wheelchairs, for us is very inspiring to be able to wake up every day and do that, because we have the ability. About 9 out of 10 people, Linda, who come to see us do phenomenally well, have stories like Rhonda's, and about 1 out of 10 of them, the bones are so bone on bone, and so far that one bone is actually creating a groove in the other bone, and that becomes a surgical situation. But those folks are often in wheelchairs. It's very rare that someone with a cane or a walker can't be helped, right, without surgery. Sometimes surgery is necessary, but very rarely, because the technology has changed so much. And in Rhonda's case, she was thinking about a wheelchair, right? And she didn't want surgery. And she said, well, what else am I going to do? I'm kind of in the donut hole here, you know? What do I do? And so she saw the message, right, that we had a free treatment. She took an opportunity to come in, try it out for free, which I would encourage everybody to do if you're having knee problems and you identify with kind of how Rhonda's feeling. This could be something for you.
Absolutely. So Rhonda, were the treatments painful?
No.
That's fantastic.
And you sit in the decompression chair, they just, put a strap around your top of your thigh and your calf area, and then it just, you feel it, but it doesn't hurt.
Mm-hmm.
You just feel like pressure, I would say, maybe that's the best word. But it's not like painful or anything. You sit there and you talk to your physical therapist.
That's fantastic.
And then 7 minutes goes by, like real quick.
So this is really breakthrough new technology. Non-surgical, not painful. What exactly does it do, Dr. Novelli?
So there's 3 components to the program. One is the knee decompression. That's where it takes the bones of your legs and it stretches them out very slowly, right, Rhonda?
Very
slow,
Mm-hmm.
gentle, and it literally takes the pressure off of the cartilage. When you do that, now the body can repair itself. Imagine like when things are squished together, blood can't flow, so the body can't heal. Just like if you were laying in a hospital bed for too long, you can get a pressure ulcer, a bed sore, right? Pressure prevents healing. So we have to decompress, take the pressure off. That's step 1. Step 2, we use a laser. We shine that laser. It's a class 4 laser inside the knee joint. And the lasers act like a magnet for your immune system. God gave us this immune system to heal our bodies. And that's what it does. It accelerates the healing. So a laser will tell the body where the problem is, and the immune system comes to the area. And it brings things like stem cells to the area. And we've all heard about stem cells. You can get an injection of someone else's stem cells in your body, or you can use your own, right? If you shine a laser on it, your own stem cells will come to the area, Rhonda, and it actually repairs it and regenerates the cartilage. So that's step 2, cartilage regeneration. And step 3 is using the matrix device, which uses 4 suction cups around your knee joint. And what that does, Linda, is it brings the blood flow and the circulation back. So it brings blood to the area. It gets rid of the inflammation, and it brings healthy blood, which of course has stem cells in it. And so you combine the laser with the matrix and you bring all the stem cells to the area, and then you shine the laser on the problem area and the stem cells magnetize to it. And
wow.
It's an amazing combination of therapies, but all brand new 2023 technology, FDA cleared specifically for this problem, and the results have been phenomenal.
Wow, it's really the body healing itself. You're allowing the body to heal itself. So for people who are listening and let's say you've had allergies to drugs, you don't have to worry about any of this because it's your own body that's coming to the rescue to go to heal an area that's got inflammation.
That's the beautiful thing about it. It's we have this powerful immune system that's more complex than we could ever create ourselves, right? The Creator gave this to us. And if we can simply get it to the area, that's the biggest problem that we have is compression of the, same thing in the spine, compression, right, of our lower backs prevents the blood from flowing and the body breaks down. Same thing in the knee. It's the same problem, right, Linda? It's just compression, and simply we open the area up on a regular basis for about 6 weeks, and the results that Rhonda had are typical. This is what we were expecting, and this is, it's really turning over the expectations of patients now to say, wait, I don't have to go for a knee replacement.
Right.
My doctor told me that was the only option, and it was previously. And we're changing that.
Oh, yes, you are. Let me give everybody your information. Folks, if you would like to do what Rhonda did and go for that free evaluation, that free treatment on Thursday night, if you have knee pain, Thursday is your night, okay, at 6:30 for knee pain. You want to make a reservation just so they know you're coming. It's 716-222-KNEE, okay? It's easy as that, 222-KNEE. And you can just say, look, I'm coming in, I'm gonna bring somebody with me, 6:30 p.m., and they can talk to you and they can introduce you to the staff and they can talk about what it is they do. Now, if you have other types of neuropathy, you've got that painful tingling in your hands, maybe you've got that back pain, Tuesday night is for you at 6:30, and they'll do the same thing. They'll meet you, they'll talk with you, they'll go over what it is that they hopefully can do for you, and then you can take it from there. Office is super convenient. It's 3045 Southwestern Boulevard in Orchard Park, okay? It's the Novelli Wellness Center. It's a beautiful modern building with lovely people just waiting for you inside. And hopefully, and really there's no reason to believe you wouldn't have the results that Rhonda Stoll has had. Rhonda, in fact, it's funny because before Dr. Novelli walked in, we were talking about the fact that we're traveling again on senior radio, and Rhonda's eyes lit up, Doc, because she's like, that might be something I'd be interested in. I bet a year ago, Rhonda, traveling or going to Europe or something like that was just like totally out of your realm.
Yeah, last year I went to Punta Cana with a friend of mine, but it's like a large resort. It was troublesome because it was a lot of walking and they had to wait for me half the time.
So what are you looking forward to doing now that you're feeling better?
Oh, well, travel. I love travel. We have we're going to Scotland next year and stuff, so
Look at
that's a lot of
that.
walking and
Yeah.
hills. So I'm looking forward to that and just walking in general. Like I used to walk on my lunch, which I stopped doing because it was so painful.
Wow.
So I'm looking to start doing that now. And
That's fantastic. Good for you, Rhonda. And again, because you took a chance and said, I'm going to try this. And look at you, just 7 weeks later.
Yeah.
You know, that's amazing.
It's nothing to lose. It's a free seminar.
Yeah, nothing to lose but your pain. We
Yeah.
talk about that all the time. And Dr. Novelli, it's got to be really gratifying for you to see Rhonda and see these kinds of results that you're getting.
Absolutely,
with
we're
your
high-fiving
equipment.
over here.
It's
And,
fantastic.
that's what it's all about, it's restoring the quality of life. People, the moment people say, oh, I can walk again, I can climb stairs again, instantly their values shift, and they say, okay, what's possible now, right? Let's go to Scotland, right? Boom, let's go, and then you're
Let's
on your
live
way.
our life.
Let's go to Europe with Linda Pellegrino and go
Absolutely.
to the holiday markets.
Yeah, it's going to be
Right?
fantastic. And folks, here's more good news. Insurance does cover much of this. So by all means, talk with the folks when you get there. But again, if knees are your issue, Thursday night is your night. It's 6:30 p.m. But do call just so they can expect you. 716-222-KNEE. That's a free treatment. It's not even a full treatment, but you'll get an idea of what it is that they can do. And then Tuesday, other types of neuropathy, spine, back, hands, arms. Tuesday night, same thing, 6:30. We invite you to go because again, you got nothing to lose but your pain with Dr. Stephen Novelli, who's a chiropractic physician at the Novelli Wellness Center. That number again, 716-222-KNEE. And remember, you hear it here on Senior Radio Buffalo.